This clinical case is presented by Sifco Medical Solutions. I am Dr. Lacoursière, Interventional Radiologist, and I'm going to present you a clinical case of renal tumor ablation with multiple needles insertion using the RAD-GUIDE device. The patient is a 66-year-old man with a small renal adenocarcinoma. He was referred to us for a CT-guided radiofrequency ablation, and we're going to show you how to perform a thermal protection technique using the RAD-GUIDE device. This axial CT image shows a hyperdense, enhancing renal mass. On this sagittal reconstruction image, the superior arrow shows a renal cyst, while the inferior arrow is pointing at the solid renal mass. A radio-opaque grid was first placed on the patient's skin to help us choosing the appropriate skin entry point to reach the target. A local anesthesia needle was first inserted to help us choose the appropriate hole within the top plate of the RAD-GUIDE to reach the renal tumor. A radiofrequency ablation needle was then inserted using the same path, allowing us to easily reach the renal tumor. The RF needle was then precisely deployed within the lesion. In order to avoid any lumbar nerve injuries in the burning process, we decided to insert a Shiba needle between the renal mass and the nerves and inject CO2 and cold dextrose containing contrast media in order to obtain a thermal protection of the nerves. At a certain point during the procedure, I wanted to get back to complete freehand control of the Shiba needle in order to change the site of injection of CO2 and dextrose. So because I didn't want to move the RF needle already in the top plate, I simply had to break the top plate in two pieces, allowing me to avoid moving the RF needle and getting back to complete freehand control of the Shiba needle. If needed, I usually break the top plate using fingers of both hands, and sometimes I also use scissors just to start breaking the plate in two pieces. This clinical case illustrates how the RAD-GUIDE supports heavy needles such as the ablation needle. A unique feature of the RAD-GUIDE is its possibility to support and guide several needles at the same time, which is very often requested in radiofrequency ablation. And this case illustrates the possibility of getting back to complete freehand control of the needle, even though you're using several needles, simply by splitting apart the top plate of the RAD-GUIDE.